Isolation is a protective practice designed to protect either a patient from the rest of the patients and staff or to protect everyone else from the patient. There are two types of isolation nursing: source isolation and protective isolation. Source isolation is intended to protect patients and staff from an individual or a group that could present a risk of infection. For example, if a patient has vomiting and diarrhea, there may be a case for isolation to prevent other people becoming sick. A sign with the letter S on it notifies source isolation. Protective isolation is signified with a P and, as the name suggests, is used to protect a particularly vulnerable patient from infection by hospital staff and patients. Isolation rooms still need to be cleaned, but if you're feeling under the weather, for example, if you have a mild cold, sore throat or stomach bug, you should not, under any circumstances, enter a room identified as being used for protective isolation. Always talk to your supervisor if you're in any doubt. Before cleaning, ensure you have the correct PPE, enough cones, and are familiar with the layout of the area. Cleaning should be done with the yellow disposable cloths and mop heads. Make up the chlorine solution as per instructions. Remember, only trained staff wearing the correct PPE are authorised to make up the chlorine chemical solution. Before entering any isolation area, always clean your hands either with soap and water or alcohol gel. Daily cleaning of isolation rooms follows the same basic principles as normal ward cleaning, so always start from the furthest point in a room and work your way to the exit, cleaning each area from the top down. Always start with the curtain rails and overhead lights, and proceed to clean the tables, overbed lights, lockers and the chairs. Then move on to bumper rails, switches, sockets, patient line handsets and nurse call buttons. Then windowsills, radiators and bed frames. If the isolated area has more than one bed space, follow the procedure for each until all bed spaces have been properly cleaned. Remember to change your apron and gloves between each bed space and to use a new mix of cleaning solution for every bed space. To complete the isolated area, clean all sinks and pipework, visitors' chairs, edges, ledges, door and door frames. Finally, vacuum and dolly mop the floors. In addition to regular daily cleaning, isolation rooms require enhanced cleaning to reduce the risk from contamination of high-touch areas. This additional cleaning is done with the chlorine chemical solution, so PPE will be needed, along with the yellow disposable cleaning cloths. Thoroughly clean all high-touch areas, including all grab rails, toilet flushes, call bells, light switches and toilet roll holders. Once the isolation room has been properly cleaned, make sure to take all used cleaning materials for correct disposal.